and thank you for joining us today on the COPD Network, where we talk about all chronic obstructive pulmonary diseases. Tonight we're going to cover our very favorite topic, asthma. This is an important topic because of all the things that people could be bad at, they choose to suck at breathing. What people don't know, however, is that this is a serious chronic obstructive pulmonary disease of the bronchioles. The bronchioles constrict, which doesn't allow adequate airflow to the person when they breathe. This is all the time. Imagine the misery. But to make things worse, people also have asthma attacks, which are episodes of serious airway constriction that is characterized by coughing, wheezing, and difficulty breathing. If you want to hear some more information, we have a special guest here with us today, Asthma themselves. Let's give it up for Asthma. Woo!
Hey guys, I'm Asthma. If you know me, I know we're not friends. When you see me coming, you know it's time to break out those rescue inhalers.
All right then, so tell me a little bit about yourself today, Asthma.
Well, I cause a chronic inflammatory disorder of the airways characterized by episodes of reversible breathing problems due to airway narrowing and obstruction.
How serious can these episodes get?
Well, the episodes can range in severity from mild to life-threatening. It causes tightening in your airway muscles due to bronchospasms. When you go around stuff like cold air, smoke, pets, when you exercise, or after you've had a viral infection, it's even worse.
You know, a lot of those symptoms sound a lot like the flu or common cold. How will we know the difference?
Well, that's a great question, and people always ask me that. You see, I don't cause fevers or your nose to run or for you to cough up anything gross. And let's just get this out of the way. I'm not contagious. But when you do see me, you'll see wheezing, coughing, chest tightness, and shortness of breath.
Oh wow, that sounds awful. Besides those horrible signs and symptoms, are there any other complications that we see with you?
Oh, heck yeah. Sometimes I can interfere with sleep, work, and recreational activity and cause you to stay home sick from work or school during severe asthma flare-ups. A person can develop permanent airway narrowing of the bronchial tubes that affects how you can breathe. Some people might even have to visit the emergency room or get hospitalized for severe asthma attacks.
Hospitalized? That sounds crazy. I hear that you affect people of every race, sex, and age. Basically that you don't tend to discriminate when it comes to who you affect. Is this true?
Yes, this is true, but I really like children, older women, younger boys, African Americans, Puerto Ricans, people living in the northeastern United States, go Yankees, people living below the federal poverty line, and employees with certain exposure in the workplace.
Exposure in the workplace?
Yeah, I mean like minors. You know how they all have the gold? I like that.
Oh, that's funny. All right, so besides preference, are there any other predisposing factors that you look for besides age, race, and demographical location?
Well, usually the people I affect have parents with asthma, sensitivity to irritants and allergens, childhood respiratory infections, and are overweight, which is why I really love America.
Ah, America does tend to have a high incidence of asthma compared to the rest of the world. Anyways, thank you so much for all of that information. We're so glad to have you here on the show today.
Thanks for having me. It's been such a breathtaking experience.
All right, let's get ready here. Now a word from our sponsors. All right, and welcome back to our show, the COPD Network. Here with us now is Dr. Asthma. Welcome to the show. How do you like it so far?
Oh, I've loved it. I love how you had asthma here, and I'm just so happy to be here. It just takes my breath away.
All right, I saw that you just used that inhaler over there. Can you tell me a little more about what that is?
Yeah, so there are a couple different medications you can use to help with asthma. There's short-acting rescue medications, which is for like emergencies such as an asthma attack, or if you just feel it coming and you just want to go ahead and use it. There's also long-acting medications that can help with long-term maintenance, such as corticosteroids or allergy medications and stuff like that. But you always need to make sure you see a doctor before you get these medications, because you don't want to get them from a creepy source. Also, the short-acting medications can be delivered via inhaler, which is what I just used, nebulizer, and the mask. Also, there are some side effects that can happen with these medications, such as when you're taking corticosteroids, it can stunt your kid's growth. So always check on that just to make sure.
Oh wow. These medications sound really expensive.
Oh yeah, it can get really expensive, especially if you don't have insurance. The maintenance medication and rescue inhalers are not always covered by insurance, but and can cost hundreds of dollars, and become really straining for families. But there's also other therapies such as immunotherapy, but this may also become a financial burden due to cost. So be sure to talk to your doctor about what you need to use for your asthma and versus the price.
So talk to people like you, right?
Yes.
Awesome. All right. So, for people like me who really can't afford medications like that, is there any other things that we could do to help prevent exacerbations?
Yes, of course. So asthma is caused by lots of things. It can be caused by allergens, just all that kind of stuff. So just make sure when you're at home, you can use your air conditioner, which can reduce the amount of airborne pollens from trees, grasses, weeds, and that find your way into your home. It also lowers the humidity in your house, which can also cause exacerbations, and reduce your exposure to dust mites. There are also simple things like just dusting your house and replacing pillowcases and vacuuming a lot that can really help. Even things like just like exposure to cold air just abruptly can cause an attack. So just make sure you know about those.
Wow, that's crazy that so many things that we see in everyday life can cause so many exacerbations. That must be super frustrating for people out there who have asthma. So, besides that, are there any definitive tests that can tell me whether I have asthma or not?
Yes. So there are what we call pulmonary function tests to determine how much air moves in and out of your lungs as you breathe. So some of these tests include the spirometry test, which checks how much air you can exhale after a deep breath and how fast you can do it. The other one is the peak flow test that measures how hard you breathe out, and it's ranged by like a color scale to help you know where your respiratory status is. So say there's like red, yellow, and then green, and so you try to breathe out as hard as you can, but you only hit yellow. That'll tell you where your respiratory status is.
Oh, that is so interesting. So anyways, on the COPD network, we like to provide our viewers with as much medical advice as we possibly can. So is there any information you'd like to give to people out there who have asthma?
Yes, so there's just a couple things that people should know. People should always have an action plan when it comes to their asthma, especially based on your symptoms, like what triggers your asthma attacks, or just like hard to breathe, and the steps that you need to avoid all that. Another thing is these people need to take an active role in taking care of themselves and learn to practice exercises like meditation when you feel overwhelmed, like when you take a test. Yeah.
All right, well, thank you so much for all of that helpful information, Dr. Asthma. That was really great.
Oh, thanks so much for having me. I love getting to talk about all this asthma stuff, and don't forget, guys, it ain't easy being wheezy.
Nice. All right, guys, that is all the time we have for today. Y'all have all been just a breath fresh of air, just like that inhaler over there. Have a great night, guys.